Hello everyone, my name is Christine and today I will be demonstrating the oral medication video. First thing I'm going to do is make sure I have all my supplies, which is my gloves, medication cup, a paper towel, some water, and my patient of course. So after I see that I have all my supplies, I will start checking the provider's order. And then I'll be reviewing the 6 rights: the right patient, dose, administration, time, route, and documentation. And then I will check the EHR and the medications that I have. I am picking MAR number 3, which includes amoxicillin 250 milligrams, metformin 500 milligrams, Benadryl 25 milligrams, and liquid acetaminophen 500 milligrams per 15 ml. I go to the patient's room, knock on the door, enter the room, close the curtain for patient's privacy, and perform hand hygiene. Hello there, my name is Christine. I'll be your nurse today. Can I get your first and last name and date of birth? I check the wristband and verify that is the correct patient. Okay, so today I will be administering you some medications today. Do you have any allergies? No allergies. Okay, so I'm gonna perform hand hygiene and then put on my gloves. This is gonna take about 5 minutes, and I'm gonna be explaining to you all the common and adverse side effects. If you have any adverse side effects, please let us know immediately. I make sure my patient is seated or lying on the side position, whatever is comfortable for them. Okay, so I review all the medications with the MAR again, and then with the patient at the patient's bedside. Okay, so I'm gonna start. So the first medication is amoxicillin 250 milligrams, which is an antibiotic. Some common side effects is nausea and diarrhea, and then adverse side effects are wheezing and hives. Put that into the cup. Next medication is metformin 500 milligrams. This is used to control your blood sugar. It is for your diabetes. Common side effects are decreased appetite and diarrhea. And then adverse side effects are abdominal pain and shallow breathing. The next medication is Benadryl 25 milligrams, and this is for allergies. Some common side effects are drowsiness and dizziness. And then some adverse side effects are urinary retention and seizures. Okay, so I have all the medications in the cup for the patient. You can go ahead and take all this at the same time or one by one. Which do you prefer? Okay, all of them? Okay, so, and then is water okay for you? Okay, water is good. So I have my patient take the medication. And then some water. I assess that my patients check if everything's okay, and then that they swallowed all the medications. Okay, everything looks good. So we'll move on to the next medication. So here I have liquid acetaminophen. This is 500 milligrams per 15 ml. This is going to be for pain. Some common side effects are dizziness and nausea. Some adverse side effects would be jaundice and some black tarry stool. So before we get started, do you have any questions? No? Okay, great. Okay, so then I want to take a look at the liquid medication, make sure it's all mixed up, and I want to turn it to the side if needed, just to make sure everything's all mixed up. Okay, so everything looks pretty good, everything's all mixed up. So now I'm gonna make sure I'm on a flat surface, and then I'm gonna open the lid, and then put the lid down. And then before I pour, I want to make sure my hand is covering the label like this, just in case the medication gets on the label and we don't want it to ruin the label. Okay, so the dose today is 15 ml. So I'm gonna get down to make sure it's 215 ml. Okay, so before I put the lid back on, I'm gonna take a little paper towel and then wipe the top, so it doesn't get all goopy. I'm gonna dispose of this, and then I'm gonna put the lid back on. Okay, so I'm gonna be administering you the acetaminophen. So here you go, and then some water. So next, I assess my patient that they have taken the medications and there's no issues. And then I'm gonna help the patient back into a comfy position. I'm gonna take off my gloves. So everything looks good. and then dispose of this. Perform hand hygiene. Okay. Okay, so here's your call light, and then your side rails are back up. Are you comfortable? Do you have any questions, or do you need anything from us right now? No? Okay, great. So my patient's all good. So now I'm going to document my procedure. My documentation will include the right medication, right patient, right dose, right time, and the right route. And of course, documentation.